Welcome back, Chronics, and thanks for joining me. Today we're talking about emergency care for those of us with Ehlers-Danlos syndrome or hypermobility spectrum disorder. It's usually a nightmare, and I watched this amazing talk given by the Ehlers-Danlos Society with Dr. Hakim, and he kind of gives an overview as to why that is. Since the ER is focused on stabilizing you, they will not give you a differential diagnosis, which means what is causing the crisis. They just want to end the crisis, which thank you. But you would hope that they know about Ehlers-Danlos syndrome, about hypermobility spectrum disorders, because, we're a little different. But that's usually not the case. For example, if you have a horrible headache, worse than you've ever had before, you go to the ER, they know you have EDS and they just assume that it's related to that. And they don't look beyond that because they're forgetting you're also a normal person with normal problems. You got to look for everything because that bad headache could be like a vascular bleed. Nobody wants that. Dr. Hakim gave an example of a woman who went to the emergency room having seizures, which were actually related to problems caused by her EDS, but they thought she was a meth addict, so there's that. On the flip side, say you're going into the ER with really bad chest pain, they should make sure you're not having a heart attack before they consider any muscular inflammation situations caused by EDS, like a rib subluxation. Bruising is common with us, so if we show up to the ER with many bruises and we don't have a good explanation for them, there will be questions, I'm sure, just because everybody assumes the worst. But I'm actually assuming the worst, knowing they're going to assume the worst, so we're kind of tied for first, you know what I mean? Then the other situation we run into is we have a diagnosis, but that attending doctor doesn't believe in that diagnosis or know what that diagnosis is or wants to listen to anything related to that diagnosis, in which, well, in that situation we're screwed and we just have to hope for the best. Still be especially clear about what medications work and don't work for you, unless they want to have another crisis on their hands. They can choose not to believe you, but it's going to be their problem, so. Anesthetics sometimes don't work on us. We need more, much more, to get the same effect as a normal person. Definitely let your doctor know about that, or, when they go to do the procedure and you're completely not numb, just make sure to scream loud enough to get their attention so they can actually give you the right amount of anesthetic. Other things we can pass along which may or may not be helpful is that we need a lot of stitches and we need to keep that wound clean. Maybe put some steri strips over it to hold it together because, when you're dealing with insufficient material, you got to take some extra precautions, like double knot it like once or twice and just really make sure it's anchored in there. Definitely tell them what you know and hopefully they will do no harm, because they had said that they wouldn't in that Hippocratic Oath thing. Let's hope they take that seriously. Thank you again for joining me, Chronics, and remember to stay strong, don't give up, and don't take crap from anyone, because you just don't have time for it, even in the emergency room. I will talk to you guys soon.